Welcome to Brainetainment, your go-to channel for insightful knowledge about health and wellness. Here we make complex health concepts easy to understand, equipping you with the knowledge you need to take control of your well-being. Our mission is to empower you to make informed decisions about your health, because we believe that knowledge is the first step towards a healthier, happier life. Today we turn our focus to a crucial health matter that often goes unnoticed until it's too late: heart disease in men. It might surprise you to know that heart disease is the leading cause of death for men worldwide. But the good news is, early detection can make a world of difference. By knowing and recognizing the early signs of heart disease, you can take proactive steps to manage and even reverse its course. In today's video, we will discuss the 10 warning signs of heart disease in men. The first early sign of heart disease in men is chest discomfort. Now, when we talk about chest discomfort, we're not necessarily discussing a sharp, stabbing pain. It's more of an uncomfortable pressure, a squeezing sensation, or a feeling of fullness in the center of the chest. This discomfort may come and go, lasting for a few minutes at a time. Why does this happen, you might ask? Well, when your heart muscle isn't getting enough oxygen-rich blood, it sends out a distress signal in the form of this discomfort. It's as if your heart is telling you, hey, I'm not getting what I need here. You see, this chest discomfort, also known as angina, is often triggered by physical exertion or emotional stress. But here's the kicker: it can also happen when you're resting or even sleeping. It's crucial not to ignore this symptom, as it can be an early warning sign of a heart attack. Another common sign of heart disease is shortness of breath. Picture this. You're climbing a flight of stairs, something you've done countless times before, but this time you can't seem to catch your breath. You're not running a marathon, just going about your usual day, and yet you find yourself gasping for air. This is what we mean by shortness of breath, and it's not something to be taken lightly. Unlike normal breathlessness after a workout or strenuous activity, this shortness of breath can occur even during rest or minimal physical exertion. It's your body's way of telling you that your heart might be struggling. Why? Because your heart is responsible for pumping oxygen-rich blood throughout your body. If it's not working optimally, your body's oxygen supply can fall short, leaving you feeling breathless. This symptom is a critical warning sign. It's your body raising a red flag, signaling that your heart might not be able to keep up with its vital role. Shortness of breath can signify a problem with your heart's ability to pump blood. Feeling unusually fatigued can also be a sign of heart disease. It's an alarming thought, isn't it? Yet it's essential to understand why this is so. Fatigue is a common symptom of heart disease because the heart is not pumping blood as efficiently as it should. This means your muscles and tissues aren't getting the oxygen and nutrients they need to function properly, and as a result, you feel tired. Imagine your heart as a fuel pump and your body as a car. If the pump isn't working correctly, the car won't run smoothly. Fatigue can be a subtle sign, often dismissed as the result of a busy lifestyle or lack of sleep. However, if you're feeling more tired than usual, particularly after activities that used not to tire you out, or if you're frequently needing naps, it's time to pay attention. It's always better to be safe than sorry, so if you're feeling more tired than usual, it may be worthwhile to seek medical advice. Excessive sweating and nausea are other potential signs of heart disease. When our bodies undergo stress or experience something abnormal, they respond in various ways. One such response is breaking out in a cold sweat or feeling nauseous. Now, you might be thinking, I sweat when I'm nervous or eat something that doesn't agree with me. True, but the kind of sweating we're talking about here isn't your typical perspiration. It's an unexplained excessive sweat, often accompanied by a chilling sensation, even in cooler temperatures. Similarly, nausea or a lack of appetite, especially when coupled with other symptoms we've discussed, can be your body's way of signaling a problem with your heart. The connection between these symptoms and heart disease lies in the heart's reduced ability to pump blood efficiently. This inefficiency can affect various bodily functions, leading to symptoms like sweating and nausea. Remember, these symptoms can often be overlooked, so it's important to be aware of them. Experiencing an irregular heartbeat is another potential sign of heart disease. An irregular heartbeat, also known as arrhythmia, may present itself in a variety of ways. You might notice your heart is beating too fast, too slow, or it may seem to skip a beat. Sometimes it might feel like a fluttering sensation in your chest. So, why is an irregular heartbeat a warning sign? Well, it's because your heart is not pumping blood as efficiently as it should. It may be struggling due to a blockage, damage, or disease, and when your heart doesn't pump blood correctly, the rest of your body can suffer. Your brain, your organs, your muscles, they all need a good supply of oxygen-rich blood to function properly. This is why it's essential to pay attention to your heartbeat. If it feels off, it's crucial to seek medical advice. Remember, your heart is your body's engine. An irregular heartbeat could indicate an underlying heart condition. Swelling in the legs, ankles, and feet can also be a sign of heart disease. When our hearts are in tip-top shape, they pump blood efficiently throughout the body, supplying our organs and tissues with the oxygen they need. But when heart disease is at play, this process can be compromised. Imagine your heart as a powerful engine. Now, if that engine starts to falter, it can't pump as effectively. This can lead to a buildup of pressure in the veins, which in turn forces fluid into the surrounding tissues, causing what we call edema or swelling. This is most commonly seen in the lower extremities, the legs, ankles, and feet. While it's important to note that swelling can be caused by a myriad of factors, persistent or recurring swelling should not be ignored. It's a signal that your heart might be struggling under the pressure, and it's time to seek medical attention. This symptom can indicate that your heart isn't pumping blood effectively. In a nutshell, these symptoms are signals from your body that something may be wrong with your heart. They're not to be ignored or brushed off as insignificant. Remember, if you're experiencing any of these symptoms, it's important to consult a medical professional. The sooner you seek help, the better your chances are of preventing serious heart damage. Don't gamble with your heart health, it's simply not worth the risk. Awareness is the first step towards prevention and early detection. How many times have we heard this? And yet it remains as true as ever, especially when it comes to heart disease. This silent killer can creep up on anyone, but it's not completely stealthy. It leaves telltale signs, early symptoms that we've spent the last few minutes discussing. Chest discomfort, shortness of breath, fatigue, excessive sweating and nausea, irregular heartbeat, swelling in the legs, ankles, and feet. These are not to be ignored. If you or someone you know experiences these symptoms, don't hesitate to seek medical advice. It could be nothing, but it could also be the early warning signs of heart disease. Remember, the sooner it's caught, the better the chances of managing it successfully. We can't stress enough the importance of being proactive about your health. Thank you for watching Brainy-tainment. Don't forget to subscribe for more educational and insightful videos.